We'll move on to another possible cause of hypertension, and here we are trying to say kidney disease. So, how can, particularly, I'm talking about chronic kidney disease. How can it cause hypertension? To me, I would say that the kidneys are actually what they're responsible for what filtering waste out of the body. So, if the function of the kidney is declining, the filtration of waste and fluid from the body is reduced. So you have accumulation of waste and fluid back in the body. So this is likely to cause what high blood pressures because the volumes of fluid in the body is now increased. So to say the volume is expanded. So it causes hypertension because damaged kidneys cannot properly what filter out sodium, filter out water, and filter out hormones. Do you understand? So this leads to what? A build back of these things in the body. Okay? And the renin angiotensin aldosterone system is overactivated. But let's look at the mechanisms, one by one. So reduced nephron mass. So if the kidney units are functioning less, sodium and water is not being put out of the body efficiently. So this can cause a lot of fluid retention, and the volume of this fluid in the body is expanding. They'll have RAAS activation. So damaged kidney cells reduce blood flow, and like if the kidney is damaged, blood is not coming much to the kidney, and rather the kidney will sense as if the blood flow is a systemic issue. It will release a lot of renin. Renin will go on to become angiotensin 2, and angiotensin 2 will further make the blood vessels constrict. Then also the sympathetic nervous system overactivity is CKD will keep stimulating renal nerves and to increase adrenaline secretion, and this will actually what raise the vascular tone and the blood pressure. So endothelial dysfunction too is there, where CKD reduces what nitric oxide production. So this will furthermore stiffen the arteries and impair vasodilation. So other secondary factors include if a person is treating anemia with erythropoietin, it causes a lot of vasoconstriction. Secondary hyperparathyroidism increases intracellular calcium, and uremia, where there's toxin buildup. Okay, also causes vasoconstriction because it will impair how relaxed the blood vessels will become. So clinical features is most patients having chronic kidney disease, you find this you know you find this hypertension in them. Okay, so often it is resistant hypertension, and blood pressure may rise suddenly or become difficult to control. So it's usually associated with the kidneys passing out urine, and there's proteins in it, and there's accumulation of fluid causing edema, and the glomerular filtration rate, that's the amount of waste that the kidney is producing, is reducing by the day. So why this matters is a bi-directional relationship. Hypertension worsens chronic kidney disease. Chronic kidney disease worsens hypertension. Okay, and there's also risk of heart diseases, heart attack, strokes, heart failure. You know, and it keeps progressing, and it can ultimately become the end stage renal disease. So you manage it based on the patient has to reduce the amount of salt that they are taking. Then you can use the angiotensin converting enzyme inhibitors or angiotensin receptor blockers as drugs to treat this. Then also diuretics, where it will help to actually put out a lot of fluid from the body. You know. So lifestyle measures, weight control, make sure that your weight is down. You know, do a lot of exercise, limit the amount of alcohol that you take. Then they can also be doing ambulatory blood pressure monitoring, where they can put a machine on you, you go around with it, and this helps to dictate if there's any slight rise in your blood pressures. Okay, so that's what we have for the link up between chronic kidney disease and also hypertension.